Hi, my name's Steve Taylor. I'm Chief Scientific Officer of Zegami, and I'm here to talk today about how we built a deep learning model to detect the differences between healthy bacterial pneumonia, viral pneumonia and COVID-19 X-ray data. And this data was sourced from Joseph Paul Cohen, who's got a GitHub data initiative at the University of Montreal. And we've also added to this data from a Kaggle competition to try and balance the amount of data out. So you've got equal numbers in each different category. And one of the nice things we can do with Zegami, we can start looking at these images straight away, and you can see that some of these have patient notes. These are all anonymized data, of course, but they do have some details about the various conditions and some of the clinical notes, and this will be vital if we want to develop the model for a more prognostic abilities down the line. So this is what's called the grid view. This is the initial view in Zegami, and we can get a good kind of overview, and you can see there's a variety of different contrasts and different sort of blurriness, which is what you'd expect from a large selection of images like this. You can look at this in a graph view, and this will allow you to let's say look at these via condition, and you can see we've got 162 for each particular class at the bottom, and this is like a bin view basically, so it allows you to get a sort of more quantitative look at your data. And we can do things like color by column, which allows us to apply a color based on a particular value in the data set. So in this case we've used condition. We could of course colour on any of these particular values, but it's obviously easier, then we can spot where the different classifications are using these colours. So having a look at this in this scatter plot view, so what we've done here, we're looking at a TS&E clustering, which is a dimensionality reduction technique, and we've basically trained our model with the different data sets, and it's basically classified these into these 4 different categories, but we've taken the last layer of the model and used that to inform the clustering. And you can see here these cluster nicely into different groups, whereas up here with the yellow you've got COVID group, here you've got a mixture of bacterial and viral pneumonia in the blue and red, and there you've got in the bottom corner you've got the green, which is healthy. What's interesting, the sort of things you can do with Zegami of course, is you can look to see what's going on in some of these clusters. Like for example here, these data are probably ones you don't want to keep, because if you compare them to the other ones, these are actually side views or lateral views, so they may confound your model. You've also got interesting cases where you've got this kind of joining cluster here. Maybe that's because there's some indistinct images there, but again you could either remove these or spend more effort training these. And also of course you can see, as you'd expect with a model like this, you've got some red and green kind of mixed together. Maybe this viral pneumonia, for example, maybe doesn't classify quite so well. We can look at some of these other values to see how well it's done. We can go to this sort of graph view as well again, and we can look at the condition. We can look at the estimates. So for example, we can look at how well COVID's done. So these are basically a probability about how well it's assigned the class, so, or a softmax score, and you can see here that there's a high probability that these COVID ones are correct, and you've got, as it sort of comes over here, you can see non-COVID ones falling there. You do get a few COVID ones, and we estimate we've got about a 70% correct prediction. And you can see, again, you can look at why these were misclassified. But overall, this works about sort of 70% of the time, and we think this could be potentially used if we had more data and more images from different sources as a more prognostic tool that would help a clinician's workflow, so they could use this to compare different images and really try and help triage large amounts of patient data in the COVID crisis, or potentially other situations where you might have lots of x-rays and want to use that as diagnosis.